Thank you very much, and thank you to the Minister for being here today. Today I am here to speak about the investment in Portiuncula University Hospital and Roscommon University Hospital, and the reason I am here today is because our Taoiseach Leo Varadkar nominated me to represent my region of Roscommon, Galway. As somebody who is quite new to public life, I've had the opportunity to fight for and make sure that our region is represented and that our region stands out when it is fighting for balanced regional investment. And that has been the mark of the man that nominated me here today to speak and be able to speak here around these hospitals. Last February in 2023, the Taoiseach Leo Varadkar met with the senior clinical team in Portiuncula University Hospital, and at that time he got an opportunity to actually walk about the hospital, to see the emergency department, to see the pressures that hospital is facing. But he also had the opportunity to see over €34 million of an investment in a 50-bed ward block that was allocated in 2019 with Minister of then Health, Minister Simon Harris. It is important that we see that this investment in our hospital is an investment for the future. But I am here today, Minister Burke, and I know that you are taking this on behalf of Minister Donnelly as the Minister for Health. I am here to speak about the expansion requirements around the emergency department. When the Taoiseach visited Ballinasloe last year, he very much saw the improvements and the development and the progress of the investment to date in the hospital. However, he also saw the pressures that are there in the emergency department. Out of all the hospitals in Ceuta, that is the one emergency department that has not seen any work in that hospital over the last number of years. I know that there is very much support from the Ceuta and now the new regional executive in terms of the North-Northwest in seeing investment into this. Currently in the HSE capital plan that is listed at a design stage last year, we worked hard to ensure that that project was moved forward. I now want to see that this project is a priority and is moving forward, because that is for the people and patients, over 400,000 across 4 counties that use and call that hospital their own. Minister, I'm also here today to speak on behalf of Roscommon University Hospital. There has been such magnificent sort of investment as well here in terms of the hospice, the Mayo Roscommon Hospice, and again so many volunteers that came together to open up this facility of over 8 beds in the area. Roscommon University Hospital is giving palliative care staff, Minister, in relation to this. The hospital has seen a reduction in waiting lists, and I know that there's real specialties here in this hospital as well in terms of plastics and reconstructive surgery. It really is using leading edge and innovative technologies. But what we also see here is that there's a real increase in day surgeries. You know, over 15 to 20% increase in terms of minor injury unit activity, also in day surgeries. But the challenge we have here is that people cannot even get parking, Minister, because it's so busy in this hospital. They can't find parking. We had an update from the Ceuta group and from the general manager there, Marie Doorley, who spoke about that they need, very basically, a spatial development plan. What I'm asking here, Minister, is what is it that needs to drive the spatial development plan? Because nothing else can happen in this hospital until we see the likes of improvements in the day surgery ward, until we see the improvements in the rehab unit that's been planned for Roscommon University Hospital. We're seeing new, unique skill sets. Jobs been provided in the Roscommon area through this hospital, but we need to make sure that there's a plan for expansion. None of this can happen unless there's a HSE spatial development plan. Minister, the capital plan from the HSE and the Department of Health, we have never seen a larger budget been allocated by government to this. We have never seen it. But what we need to see is balanced regional development so that everyone on this island of Ireland receives the same care and services, and that should be happening under this government. And that is what I want to see in terms of Portiuncula University Hospital and Roscommon University Hospital within Ceuta.
Thank you very much, Senator Dolan. Minister.
Thank you, Cathaoirleach, and I thank Senator Dolan for all her work on Portiuncula Hospital. I know she's been a very strong advocate in government and with the Taoiseach and indeed Minister Donnelly. Minister Donnelly acknowledges the work Senator Dolan has and thanks her for the opportunity to provide an update on the progress of the emergency department expansion in Portiuncula Hospital and the Roscommon Hospital Spatial Development Plan. Portiuncula Hospital is part of the Ceuta University Hospital Healthcare Group. Portiuncula Hospital is a Model 3 hospital operating a 24/7 emergency department with over 26,000 ED attendances per year. Portiuncula Hospital provides acute surgery, medicine, critical care, daycare oncology, maternity, neonatal and paediatric services. The Capital Plan 2024 is with the Minister for Health for review and approval. The Capital Plan 2024 will be published in line with the established procedures once it is approved. A capital submission for the expansion of the emergency department at Portiuncula Hospital was submitted for consideration by the National Capital and Property Review Group in March 2023 and was approved by the group in May 2023. The project will increase the number of bays in the emergency department by 9. Currently, there are 14 treatment bays and 2 resuscitation bays. This will provide capacity to deal with children in a segregated area of the department. Support facilities shall also be provided. I can confirm on behalf of the Minister that the Emergency Department expansion is in the Capital Programme 2024 and the design team were procured in Q1 2024 and are currently progressing with the initial Stage 1 design of the project. Other developments ongoing at Portiuncula Hospital in the construction phase of the new 50-bed ward block, which is due to be completed by Q2 of 2024. Following handover to the HSE, the new 50-bed ward block is expected to be in service and occupied in Q4 of 2024 upon the completion of the following: equipping, fit-out and furnishing of the unit, familiarisation training of medical staff of newly installed systems, registration of the new building with Health Information and Quality Authority. Roscommon University Hospital is a Model 2 hospital, also within the Sélta University Healthcare Group. HSE Capital Estates have confirmed that they are liaising with Roscommon University Hospital and Sélta Hospital Group on the commencement of a spatial plan for the Roscommon University Hospital. An updated spatial plan is required to allow for a 25-bed rehabilitation unit, new clinical programmes and associated outpatient clinical space at the hospital. The design process for the 25-bed rehabilitation unit will be progressed in parallel with the updated spatial plan for the entire campus at Roscommon University Hospital. A meeting has been arranged for early April 2024 to commence this process. All capital development proposals must progress through a number of approval stages in line with the infrastructure guidelines which supersede the Public Spending Code, including detailed appraisal, planning, design and procurement before funding for each stage can be confirmed. The successful completion of the various approval stages will determine the timeline for delivery of the capital project. Thank you.
Thank you very much. Senator Dolan, you have 1 minute to respond.
Thank you so much, Minister. This is indeed welcome news. It is fantastic, of course, that 50-bed ward block, that we're going to see that open. That will be open, hopefully, by September of this year. And it will be fantastic for the teams, the managers, the patients and the families that rely on that hospital. As you've mentioned here, it's particularly around access to additional space in the ED as well is crucial here, because we're seeing the expansion of the ED. As you've mentioned there, it's an additional number of bays that will allow more space for paediatrics. We're seeing more families coming to live and work in the West. We're seeing, it's wonderful to see so many families expanding. We have over 1,300 babies, of course, in Portiuncula Maternity Hospital. Many people, when they speak about Ballinasloe, speak about how they were born in Ballinasloe. They were born in Portiuncula. Minister, it's important that our paediatric space is fit for purpose as well. This is very, very welcome news. I welcome that it's in the HSE capital plan for this year, and I know that we'll be working closely with the teams. The teams will be working closely there with the HSE and the Department of Health around equipping and fitting out. Again, just the updated spatial plan is really necessary, as you've mentioned there, with the 25-bed rehab unit, the new clinical programmes and the clinical spaces there. Gormagat, and just to thank the meeting that's been arranged, to thank the teams for organising that meeting for April 2024, which will be absolutely crucial. Gormagat, thank you.
Thank you, Senator. Minister.
Thank you, Cathaoirleach, and again I thank Senator Dolan for all her work for this healthcare, both hospitals. As I said, a meeting has been organised for April 2024, so essentially that will commence the process, which is very important. And also, as I pointed out, that the project has been included in the capital plan for 2024, and the design team was procured in Q1 2024 and are currently progressing with Stage 1. So I'll keep the pressure on Minister Donnelly, like yourself, and hopefully they will deliver first-class healthcare for the people of the area. Thank you,
Thank you very much, Minister.